Mr Medic with a question, please.
Thank you, President. My question is for the Minister for Health. This week is Nutrition Week. Numerous scientific studies show that healthy plant-based meals can prevent and reverse heart disease, diabetes and obesity. The World Health Organization has warned that processed meat is carcinogenic to humans and has gone as far to say that no amount is safe for human consumption. This is supported by the AMA, the Physicians Committee for Responsible Medicine and Doctors for Nutrition. The Andrews Labor government recently announced it is improving the standard of meals in Victorian public hospitals, stating a balanced, nutritious diet is essential for patients to recover from their injury or illness and get back on their feet. In line with current science and the advice of leading healthcare professionals, will the Minister consider removing dangerous processed meats from hospital menus as part of this process?
Minister.
I thank the member for his question, and I thank him for his interest in healthy eating. I know he's a great advocate for healthy eating, and I also congratulate him on his recent appointment by the Parliament to Vic Health. We know, President, as the member did mention, that this week is National Nutrition Week, and I confess that when I am here in Parliament during a sitting week, I do not meet those very high standards that we all strive for, and that we want everyone in the community to strive for. But President, we know particularly for people in our public hospitals and in our public aged care facilities that eating healthy food and quality food is so important to their quality of care and improvements patient recovery. And it's very important, as we've seen through the Federal Royal Commission into Aged Care, that elderly people in particular are accessing appropriate nutrition, and we have seen incidents, particularly in private nursing homes, of malnutrition in our elderly occurring. So this is a very important issue. This is why at the last election the Andrews Labor government did commit to a review, an audit, in fact, of the food and the standard of meals being served in our public hospitals and aged care centres. And we specifically committed to ensuring that food served in our public hospitals and public aged care facilities should be fresh, healthy, and where possible locally sourced, supporting Victorian farmers and producers. So we have commenced now this audit, and this has been led by the Parliamentary Secretary for Health, Anthony Carbines, and I thank him for his work, and he'll be working closely with health experts and our health services on this issue. We committed as part of that audit to eliminating high-fat and high-salt foods from our general hospital menus, excluding specific medically required diets. So processed meats are definitely something that is being reviewed by this audit, and I take on board, and I thank the member for raising his concerns on this issue, concerns, as he explained, also articulated by a number of health professional bodies, and I would encourage them and others in the community, including patients who've got direct patient experience, to jump on the Engage website and give us their thoughts and their feedback about how we can improve our hospital menus going forward. I have written last week to our public health services and aged care services requesting their contribution to this comprehensive audit. And I look forward to having an opportunity to update the House in due course, but people can have their say by the 25th of November on the Engage website. Thank you.